everyone, welcome to this explainer. If you are looking for a totally straightforward, objective breakdown of Medicare Advantage for 2026, you are in exactly the right place. Look, choosing your Medicare path is hands down one of the biggest health and financial decisions you're ever going to make. So my goal today is to give you the exact, verified facts you need to evaluate Medicare Advantage, which you'll often hear called Part C. We're going to look really closely at the genuine benefits, the actual costs, and the absolute necessities you have to understand before making your choice. All right, let's dive right in. 34 million. That is a massive number. It's actually the number of Americans currently enrolled in Medicare Advantage. It's literally the fastest growing choice in Medicare right now. And honestly, it's incredibly easy to see why. A lot of these plans look absolutely fantastic on paper, but just like with any insurance model, there are some crucial and honestly frequently misunderstood trade-offs that you've got to be aware of before you sign up. Some of these trade-offs can seriously impact your access to care exactly when you need it most. To make sure you get the full picture today, we're going to tackle 5 key areas: the Medicare Advantage alternative, 2026 costs and protections, the network restriction trade-off, understanding prior authorization, and finally, making your decision. Okay, starting with Section 1, the Medicare Advantage alternative, and how Part C fundamentally works. There is a super common misconception we need to clear up right off the bat. Medicare Advantage is not some completely separate program. It's actually an alternative payment model for receiving your regular Medicare benefits. Think of it like this. Under original Medicare, the federal government pays your medical bills directly. But with Medicare Advantage, the government essentially pays a private insurance company. Think big names like United Healthcare, Humana, Aetna, or Blue Cross to cover your benefits on your behalf. And legally, these private insurers are required to cover everything that original Medicare covers. That's all of Parts A and B. But most plans actually go a lot further than just Parts A and B. For 2026, an overwhelming 89% of Medicare Advantage plans also toss prescription drug coverage into the mix. These are called MAPD plans. Basically, it bundles everything together, giving you Parts A, B, and D all wrapped up into an incredibly convenient package. And beyond just the convenience of bundling, there's another huge factor driving those 34 million enrollments. Advantage plans frequently include extra benefits that original Medicare literally just does not offer. We're talking routine dental care, vision exams, eyeglasses, hearing aids, fitness memberships. And get this, some plans even cover transportation to your medical appointments. These extras offer genuine, tangible value, and they are a massive reason why this program keeps growing year after year. Moving right along to Section 2, 2026 costs and protections. Let's understand the financial reality. Ultimately, it comes down to the bottom line, right? Well, in 2026, the average monthly premium across all Medicare Advantage plans is just $14. That's actually down from $16.40 in 2025. Actually, scratch that. For a lot of folks, it's even cheaper. An incredible 67% of Advantage plans in 2026 charge absolutely zero additional premium. For the vast majority of people enrolled, having the plan itself costs nothing extra per month. Just to really hammer home how widespread this is, in 2026, nearly 98% of all Medicare beneficiaries have access to at least one zero premium plan, right in their specific area. So if you've been wondering why your mailbox is absolutely flooded with marketing flyers for free Medicare plans, well, this stat validates exactly why. Okay, time for a reality check, though, because there's a critical financial detail that a lot of people miss. Even if you snag one of those zero premium Advantage plans, you still have to pay the standard Medicare Part B premium. For 2026, that is $202.90 per month. That fee does not magically disappear. What you're saving with a zero premium plan is just the extra cost on top of that base fee. Plus, you'll still pay copays and coinsurance for the services you actually use, like a copay when you see a doctor or a daily charge if you end up in the hospital. But Medicare Advantage does have a very specific and highly valuable financial safety net built in. It's called the out-of-pocket maximum. This is a legally required annual cap on your medical costs. Once your copays and coinsurance hit this cap, boom, the plan covers 100% of your covered medical costs for the rest of the calendar year. Original Medicare actually doesn't have a cap like this at all. This protection is completely unique to Advantage, and it's a huge reason why people feel comfortable skipping a separate and usually expensive Medigap policy. All right, Section 3, the network restriction trade-off. Let's go a bit below the surface here. Here is the biggest catch, and honestly, the #1 source of regret for people who didn't fully understand the rules before signing up. Medicare Advantage plans are fundamentally network-based. You are strictly required to use doctors, hospitals, and specialists that are in your plan's specific network. If you decide to go out of network, whether you just really want a certain specialist or it's an absolute necessity, you're probably going to pay way more. And if you're in an HMO-style plan, you might get zero coverage. Nothing. You absolutely cannot assume your current doctors are in the network just because they accept Medicare. This network rule also has a massive geographical impact. With Original Medicare, you are covered anywhere in the country that takes Medicare, full stop. But with Medicare Advantage, if you travel a lot, or maybe you're a snowbird splitting your time between 2 states, your plan can easily leave you without any in-network coverage the second you step outside your local home area. Next up, Section 4. Understanding prior authorization and getting your care approved. So what exactly is prior authorization? Simply put, it's the insurance company's right to review and either approve or deny certain treatments, specialist referrals, or medications before you actually get them. In Original Medicare, this almost never happens. You see a doctor, they say you need a treatment, and Medicare pays for it. But in Medicare Advantage, prior authorization is standard practice. The insurer basically acts as a gatekeeper. Now, to be fair, CMS, the Centers for Medicare and Medicaid Services, has recently tightened the rules to protect enrollees from unfair delays. But it's still a very real difference from Original Medicare, and it's a layer of administration you've got to be prepared for. Finally, Section 5, Making Your Decision. Here are the 3 crucial questions to ask yourself. Question number 1, are your current trusted doctors actually in this specific plan's network? Seriously, I cannot stress this enough. Do not just Google it or assume. Before you enroll, pick up the phone, call your doctor's office directly, and ask them if they accept the exact specific plan name you are looking at. Networks change every single year. Question number 2. Do you have complex health conditions that require frequent specialist visits or major procedures? If the answer is yes, you really have to weigh those network limits and prior authorization rules heavily. Those requirements can create a whole lot of frustrating paperwork, right when you just need to be focusing on your health. And question number 3. Do you want the simplicity of an all-in-one plan or the absolute maximum freedom to choose your providers? Listen, there is no universally right or wrong answer here. Managing separate Medicare, Medigap, and Part D plans is the price you pay for total unrestricted freedom. On the flip side, Medicare Advantage gives you undeniable convenience. It really just comes down to your personal priorities. Let's do a quick recap of the whole shebang. Medicare Advantage is an alternative that bundles your hospital, medical, and usually your drug coverage into one neat package. It brings some incredibly appealing extra benefits like dental and vision, it protects your wallet with a capped annual out-of-pocket maximum, and it does all of this for an incredibly low average premium of just $14. But the cost of all those perks is access. It strictly limits you to network doctors, and it routinely requires you to get a green light from the insurance company before you can get certain types of care. Which leads us to our final thought for today. Over 34 million people have chosen this route, making it the most popular option in the country. But popularity doesn't necessarily mean it's perfect for everyone. So, is Medicare Advantage the right choice for your specific medical needs, your travel habits, and your wallet? Or is it just the most popular? Take some time to apply what we've talked about today to your own life. Thank you so much for hanging out with me for this explainer. I really invite you to drop your Part C questions in the comments below. I read every single one of them. Keep learning, keep asking questions, and I will see you next time.